Disease overview. Proteus syndrome is a rare disorder characterized by overgrowth of various tissues of the body. Affected individuals may experience a wide variety of complications that may include progressive skeletal malformations, benign and malignant tumors, malformations of blood vessels, vascular malformations, cystic pulmonary disease and certain skin lesions. Signs and symptoms. Proteus syndrome may affect bone and connective tissue, fatty tissues, skin, central nervous system and internal organs, viscera. Some individuals may exhibit only a few mild symptoms of Proteus syndrome, making diagnosis challenging. Most affected individuals are born without any noticeable symptoms. Some patients can have brain overgrowth at birth. Overgrowth associated with Proteus syndrome is irregular, disproportionate and may affect one side of the body, such as only one foot and not the other. Asymmetric. The spine may be affected, resulting in an abnormally curved spine, scoliosis. Causes. Proteus syndrome is caused by a variant in a growth regulatory gene called ACT1 that occurs after fertilization. Somatic mutation. The variability of symptoms associated with Proteus syndrome is due in part to the ratio of cells with and without the gene variant. Affected populations. Proteus syndrome is an extremely rare disorder. However, researchers with extensive experience in Proteus syndrome reviewed these reports and determined that just fewer than 100 met the stringent diagnostic criteria for Proteus syndrome. Disorders with similar symptoms. PIK3CA-related overgrowth spectrum. PROS. Disorders are a group of conditions that cause overgrowth due to the PIK3CA gene. This group includes many diagnoses with features similar to Proteus syndrome, including Klippel-Trenoré syndrome, KTS, hemihyperplasia, multiple lipomatosis, HHML, and Cloves syndrome, congenital lipomatous overgrowth, vascular malformations, epidermal nevus, skeletal, scoliosis and spinal abnormalities. Encephalocraniocutaneous lipomatosis, ECCL, is an extremely rare disorder characterized by eye abnormalities, skin abnormalities including tumors, consisting of fatty tissue, lipomas, affecting the scalp and central nervous system, and skin lesions consisting of improperly developed connective tissue nevus. Although ECCL was previously thought to represent a form of Proteus syndrome limited to the head and neck, recently researchers have delineated more specific criteria for ECCL, and it appears to be a distinct disorder from Proteus syndrome. Maffucci syndrome is a rare genetic disorder characterized by benign overgrowths of cartilage, enchondromas, skeletal deformities, and dark red, irregularly shaped patches of skin previously known as cavernous hemangiomas but are more appropriately called venous malformations. Enchondromas are most often found in certain bones, phalanges, of the hands and feet. Diagnosis. Diagnosis of Proteus syndrome is made using published clinical diagnostic criteria and molecular testing. The gene change is not present in the blood and therefore DNA testing must be performed on biopsies of affected tissue, most often skin. Treatment. Surgery can increase the risk of developing a blood clot. When undergoing surgery, close monitoring for blood clots and consideration of blood thinners to prevent blood clots, antithrombotic prophylaxis, is recommended. There is no approved medication treatment for Proteus syndrome. However, there are clinical trials to determine if KIT inhibitors can delay or slow overgrowth. Genetic counseling is recommended for affected individuals and their families. Other treatment is symptomatic and supportive. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.